Hey Maya,
Hi, Saumya. How are you?
good. How you doing?
Good, good, good.
Is this your thing? Like, have you started it, organized it?
Not my team actually. It's a group of guys who I think it's been led by someone who is training in radiology at the moment.
Mm-hmm.
Yeah, so just trying to help other guys get into radiology. So just
Yeah,
organizing programs.
nice.
And I was just serving as the academic officer for this year.
Mm.
So just helping with arranging some of these programs.
How's Kent? You've moved, right?
Yeah, I moved to Kettering, not Kent.
Kettering, sorry. How's Kettering?
Yeah. Not bad, it's cool. How's London?
Oh, I'm done with London. I'm sick of it.
You're
It's
still
the
in London,
same.
right?
Yeah, it's London's nice, but there's too many people. It's too
Yeah.
crowded. It's just I'm done with it. I
It's
think
expensive.
it's like so expensive. But yeah, I'm gonna finish training and then I'm out, man.
Okay. I think I saw you in acting a couple of times actually.
You live, yeah, I run a lot around that area, but I never see you.
I
Do
think
you
I
stay
saw
in the
you. The last time I
Imperial?
saw you, I think you were probably working with your boyfriend.
Ah, okay. He's my
Yeah, I think
fiance
that's
now.
yeah, it's possible.
Yeah.
Okay, I think we are good to go.
Yep.
Okay. All right. Okay. Just waiting for a few more people and then
Mhm.
we can start. Okay. Hi, good evening everyone. My name is Olumayo Abdul. I'm the academic officer for RIGAF, and today we'll be continuing our educational series talking about the situational judgment test components of the MSRA examination. Basically, we're talking about the techniques we're dealing with this aspect of the examination, some guiding principles, what resources to use, and we'll have a brief look at some sample questions as well and the reasoning behind the answers. And to join us today and to tackle this problem, we've got Dr. Saumya Bhagat, who's actually done well in his examination. She's currently a GPS tutor at Imperial Healthcare NHS Trust in London. She'll be helping us with this aspect of the examination. Shortly, I will be bringing her onto the stage just to get things going. Okay, so let me just do that now. Okay, so off to you, Samia.
Oh, okay. Hello, everyone. I'm Saumya. I can't actually see you, but I assume you can see and hear me. So I'm going to be talking to you about the SJT. I'm just going to tell you a little bit about myself. First, I trained in India, did my medical school in F1 in India. I came here in 2021, did my F2 standalone in Slough. If anyone's over there, I'm sorry, it's a horrible place. After that, I did a year in Imperial Charing Cross with Mayo. That's how we met. I have had the pleasure of taking the SJT twice, once before the situational, once before my UK, the F2 standalone program, and once for the MSRA. Um, I think I did all right because I'm now a GPST2 in Northwest London. So I'm just going to start off the presentation. I'm going to share my screen. Okay. If anyone can't see my screen, just shout out. And if there are any questions at all, just tell me. Just shout them out, or we can do questions at the end. So this is what we're going to cover today. what the SJT is, what you can expect in terms of types of questions, how it's scored. We're going to looking at some couple of practice questions just to get a feel of what they're like, some resources, and then see if there's any questions at the end. So the SJT test, or the professional development test, is basically it's a way to test how you should behave when posed with a challenging professional dilemma. It's nothing to do with your clinical skills whatsoever. You should assume that you're working at the level of an F2 doctor. This is important in your answering questions. And that this is taken from the MSRA SJT website, where they say that this test does not contain any knowledge of procedures or policies that would only be applicable to UK-specific localities, which means this is not supposed to disadvantage you as an IMG. I think what this means is that all they expect you to do is behave in a professional doctor with a standard forward-facing moral compass, and you should be all right. What does the SJT test? So basically, the GMC has a guideline called the Good Medical Practice. I'm sure some of you are already familiar. If you have trouble going to sleep, you can go through this 30-page document, which I've linked here. And it sort of has these characteristics that they expect anybody, a doctor in the UK, to have. So mainly summarized, it can be divided into professional integrity, coping with pressure, and empathy and sensitivity. And these are the themes that they're testing on you on during the actual test. Professional integrity is things like being honest, accepting your own mistakes, acting in the patient's best interests, taking responsibility for actions, and confidentiality. Confidentiality is really quite important, and they do test you a lot on that. Then there's coping with pressure, managing your own emotions, admitting when you need to, admitting when you're experiencing difficulty, need some help, remain calm under pressure. You're self-aware and you can manage criticism well. And then there's empathy and sensitivity towards patients and colleagues, a patient-centric approach, acting in an open and non-judgmental manner. These are broadly the themes that you will find in these questions. So there's two main types of questions that will appear in the SJT. One are where there's ranking and there's multiple choice. So ranking questions, you will be given 4 to 5 options, and you have to rank them from most appropriate to least appropriate. These actions, and this is quite important because this is when it gets a little confusing, you should think of them as discrete options and not something you do chronologically. So just see how that particular option, if done in just that or that particular option, how effective would that be in resolving the situation. And then you have the multiple choice questions, where you will be given a scenario. There'll be 8 options, and you have to choose the 3 most appropriate ones. These 3 actions together should be thought of as a bunch, and together they should fully resolve the situation. So that is quite different from the ranking questions. How are they scored? There's now 50 questions in the MSRA, down from 58. Thank God for that. There is no negative marking at all. Answers are compared to a predetermined key. So the closer your answers are to the key, the more marks you get. But you don't have to get all the ranking done exactly as the premeditated key to get all the points. So you will score marks, even if you get 2 out of 3 or 3 out of 5, that sort of thing. So always rank them and just put down something if you're not sure. So I thought we could go through just a couple of practice questions from each type of question mark, and then we can see what the GMC, these are all taken from the MSRA practice paper, by the way, and we can see why they were ranked a certain way, and that can sort of give you a little bit of idea what they're expecting. So I'm just going to read out the question, give you a few minutes to go through the options. You're a foundation doctor working in a hospital. Mr. Ahmed, a 62-year-old man, is awaiting the results of tests for bowel cancer. The ward clerk tells you that 7 of his relatives are at his bedside. His eldest has specifically asked you not to disclose the diagnosis to Mr. Ahmed that it is cancer, and as he feels that his father could not cope. Your consultant calls from the endoscopy suite and advises you that the diagnosis is sigmoid carcinoma. Rank the following actions in response to this situation. So I'm just going to give you a few minutes to just go through the answers. If you'd like, you can put the answers in the chat box and we can go through what the correct ranking is. Right, so the answer is A, D, C, and B, and we'll go through why that is. So here, this scenario is testing your empathy and sensitivity. That's the sort of part of good medical practice they're trying to focus on. A is the most appropriate. So that's tell the ward clerk that you will see the son in a side room prior to speaking to Mr. Ahmed to discuss the reason for his request. Now, this particular option addresses the problem it's the most accurate way of addressing the problem. You ask the son, why does he not want? What is the reason? And at the same time, you're also not breaking that autonomy that Mr. Ahmed has to know about his condition. So that's the most appropriate. D, which is ask Mr. Ahmed whether he would like his son to be present when discussing his results. Again, still a good option because you're talking to the patient. It's a very patient-centric approach. You are addressing the fact that Mr. Ahmed has autonomy in deciding his own treatment, but you're not really speaking to the son and trying to figure out why he doesn't want his dad to know. So that's less good from A. And then C has asked the relatives to clear the bedside as you would need to discuss the findings of the colonoscopy with Mr. Ahmed privately. So this is not a great option. So the good thing about this is that you're still respecting Mr. Ahmed's autonomy and you're still telling him what's wrong with him, but you're not taking the relatives' request into consideration at all. And option B, which is the least appropriate, is tell the ward clerk to advise the son that you have to respect Mr. Ahmed's autonomy. So this is the least appropriate because A, you are not addressing the problem yourself. You're pawning it off to the ward clerk, which is quite inappropriate, and also you're not really exploring with the son what the issue is, and you're just sort of giving him an instruction that this is what it is. Hence, this is how this question would be ranked. So we've got another one. You're a foundation 2 doctor working in respiratory medicine. Alan is a fellow F2 doctor working in the same ward as you. You see him when you're not at work. Alan tells you that he will refuse to have the seasonal influenza vaccination. Rank the following options. I'll give you a few minutes to read through the answers again. Right, so the answers here would be A, B, E, D, C. So here they're trying to assess your professional integrity. That's the part of GMC, good medical practice they're trying to assess. A, which is ask Alan why he's refusing to have the influenza vaccination, is the most appropriate because you are exploring the problem. You're asking why. B, which is inform Alan about the risk to patient, is if you just see it in its as an isolated option, it is still a good option. You're telling him that it's a patient-centric approach. You're focusing on the patients, but again, you're not exploring what exactly is the issue, why Alan doesn't want the vaccination. Then option E, which is tell Alan the GMC that he should be vaccinated against common serious communicable diseases. Again, slightly less good because you are telling him what the professional code is, but he's likely to know this anyway. You're not really exploring why he doesn't want this vaccination. And also thing to say about this particular question. So the GMC doesn't mandate that you should be vaccinated against communicable diseases, but it does advise it. So I think if this question said the GMC requires you to be vaccinated, it would probably be ranked even lower because that is untrue. And then option D is tell Alan it is not fair on his F2 colleagues if he gets influenza, as they have to cover his work due to sickness. Also not very appropriate because it's not a very patient-centric approach. You're sort of focusing on how it'll affect the workload and how it'll affect the team. And C is tell Alan he should get the influenza vaccination. Again, not helpful at all. Doesn't really address any of the issues, doesn't really address why he should get the vaccination. So this would be how this would be ranked. So we can do a couple of questions about the ranking questions. So out of these 8 options, you have to choose 3 that are the most appropriate. So you're an F2 doctor working in pediatrics. You're just about to leave the hospital after a long day on call when the nurse asks you to take a telephone call from Sarah Davies. Her 3-year-old son, Ben, has been admitted 3 times in the past month with abdominal pain. Investigations have all been normal. Ben has the same pain again this evening. When you speak to Sarah, she wants to know why the doctors have been unable to find out what is wrong with Ben, and she is concerned about his health. She is becoming upset. I mean, to be honest, you probably just leave. But for the purposes of the SJT, just think about what is the most appropriate things. I'll let you read through them. Right. So the 3 most appropriate actions would be A, D, and H. So A, which is reassure Sarah that previous investigations have been normal, seems fairly reasonable. You're reassuring the patient. D, which is ask Sarah to call the GP out of hours service. Again, entirely appropriate because you're finished with your shift. The GMC in any of these scenarios, you will come across more, does not expect you to work beyond what is expected of you. And this is, if there is a GP out of hours service that is available, I think that's perfectly reasonable. And H asked Sarah more about Ben's abdominal pain. So it's entirely possible that the abdominal pain has changed in how it has been, and now may have some red flag symptoms. So the first thing to do would be to ask a bit more about the pain itself, and then decide the steps from there. So if you think of these 3 things together, they should reasonably resolve the situation in the world of SJT, not in real life, I don't think. But that's how you should think about these questions. So there's another one. You're on a medical ward round when the consultant tells you that your F2 colleague, Emily, is to perform a pleural tap on Mr. Lucas. Emily tells the consultant that she is competent to do the procedure. However, Emily told you a few days ago that this was a procedure she had not yet performed. You have performed this procedure several times. Choose the 3 most appropriate actions. Okay. So the most appropriate here would be B, C, and H. So B is explain your concerns to Emily. Again, entirely appropriate. Tell her, why you think she shouldn't perform the procedure. C is offer help with the procedure. Again, entirely appropriate. And H is ask Emily to tell her consultant. So these 3 seem entirely appropriate, but if you look at the other options, they are not quite appropriate. So you can do it the other way around as well. You can rule out the ones that are not that don't quite fit. So insist on performing the procedure yourself. Again, slightly not the best way to deal with it. Explain your concerns to the consultant. So you're skipping a step and you're not actually addressing it with your colleague and escalating it to a consultant, which again, the GMC does not like. Explain your concerns to Mr. Lucas. Quite strange. Why does Mr. Lucas care? You would probably have to discuss it with the medical team. Get advice from the medical defense organization. Seems a little bit unnecessary, to be honest. And then bring the issue up at your next foundation teaching session. Also quite unnecessary and also not very nice. So if you look at this particular option, you can go the other way around and see which ones fit in the best. So in my 2 attempts of SJT, I developed some rules of thumbs. They're in no way exhaustive to the SJT at all, but they're just sort of some things to keep in mind when you're answering the questions. It's important to remember that the SJT is a very subjective test. It doesn't have a clear right or wrong like clinical problem solving. So it does depend a little bit on whoever's set the question paper, what they think the correct thing to do is. There is a little bit of subjectivity in there. The way you want to look at it is think of like the best, the most idealistic person, the most, does things correctly kind of person in your life, and like multiply that by 10, and that's who they want you to be for the SJT. It doesn't really reflect real life scenarios, but it is what it is. They think it's important. So the first thing that is most important is always explore. If there's a question that says this person refuses to do such and such, or doesn't want such and such, always the first option would be explore with them why that is the case. That will always be the most appropriate answer in that scenario. Attempt to resolve the situation yourself first and then escalate. So always try to see what you can do, and whichever option has saying, I would tell the nurse to do such and such, or I would tell my colleague to do, that would always be ranked below you yourself dealing with that situation. Then you should ask yourself, does this action directly address the problem at hand? This is more important for the ranking questions. So if you just took that option in isolation, does it actually address directly this problem? Or is it something that you would probably do in that scenario peripherally, but it doesn't quite address what the problem is? Never break confidentiality unless there is a risk of harm to the other person. So these I think there is some recent changes, so go through the guideline, but apart from scenarios like HIV or DVLA, you don't really break confidentiality for the patient, nor if a relative asks them or anything of that sort. Forget about hierarchies entirely. So there will be questions like the consultant comes in and you smell alcohol on their breath. Like you don't think of it as, I can't escalate, I can't talk to my consultant about this. The first most appropriate option would be, you try to address that with the consultant. So there's no hierarchy really. It's your responsibility as per the GMC to speak off, to address any kind of wrong practice that is happening. And the next one is pretty much sort of similar in that line. You take responsibility when you're witnessing wrong practices. So whether it's a colleague or it's a senior or it's a nurse, basically tattle on them if necessary, but like address it with them and sort of, don't just let it go, even if it's like small things like somebody's missing teaching for something that's not work related, silly things like that. Always take responsibility. In the ranking questions, all options should go together. So when you go through the three options that you've selected, they should sort of make sense as a bunch. And it won't happen that one just seems odd, the odd one out than the other two. And the last is, I think, follow your gut. So all of these, like I said in the beginning, are things you would do as somebody who is, a safe doctor with a very reasonable sort of understanding of what is right and what is wrong. There will be scenarios, especially when you start doing questions, that there will be two or three things that you'll feel like, I'll probably do both of these, which is entirely true. You would, in a real life scenario, do two of those options put together. But again, ask yourself the questions previously. Is this addressing the issue? Is this, am I exploring the problem? And follow your gut on what seems more right than wrong. So resources. So I did quite, I did SJT twice, and the first time that I did it, I had no experience of NHS whatsoever, and I was quite worried about it. What was quite helpful at that point was this third point, which is 20 rules to ace the SJT. It's a YouTube series. It's two IMGs who have made these like videos of basically these rules of thumb, sort of similar to the ones that I mentioned in the previous slide, and they helped me quite a lot to sort of have a baseline understanding of what they're expecting. So I would recommend that if there's you don't think you have a baseline understanding of the SJT. For the MSRA, I did the Past Medicine Question Bank and the eMedica Question Bank. I think the Past Medicine Question Bank was slightly more useful than eMedica. But I think the things that I found the most useful are these first two, the MSRA and the UKFPO practice tests. So these practice tests, they don't have very many questions, I don't think. There may be about 20 or 30 each. But they are set by the GMC. And like I said before, because there's subjectivity, the question banks that are set up by Past Medicine and other sort of these websites, they will always be slightly different to what is set by the GMC, because again, it depends on what the person who's setting the question thinks is right. But with these question banks, because they're coming directly from the GMC, they're the most reliable, and the explanations that they have put down for the questions are very good to sort of understand what exactly it is that they're looking for. The UKFPO SJT practice says the questions will be different to what you will expect in the MSRA. They have things like you have to rank answers as extremely desirable, undesirable, that sort of thing. That's not what you need to pay attention to. But again, they have explanations for those answers, and that's the bit that is helpful. So that is probably these two probably are going to be the most useful. But like I said, just remember there is a little bit of luck and a little bit of subjectivity that goes into this test. It's not something that you should rely on for your MSRA score. Your clinical problem solving test is what you should rely on your MSRA score. Both the times I did the SJT, I thought I came out thinking this was absolutely horrible. I failed it, but I ended up doing all right. So like don't think about it too much. Just do the best you can and you will be all right. And that's it. If you have any questions, let me know. I will stop sharing my screen. Right. Any questions at all? I don't know how it works, Mayo.
Thank you, Saumya, for that very informative and stimulating presentation. Over the next couple of minutes, we'll be taking questions. You can just put your questions in the chat if you've got
Yes.
any ones, please.
I either did a very good job or nobody understood a thing. We'll have to see. Right. I don't think there are any questions. But if there are, just Mayo has my number. Whenever, if there's anything that you need to know, let me know. I can give you the slides, Mayo, if anybody wants them.
Okay,
For
yeah,
the
that'll be
resources.
perfect. Yeah, okay, I'll be fine.
And that's it.
Okay. And in the absence of any questions, thank you everyone for attending this session. I hope it's been quite useful. And with regards to the examination process itself, it's like she said, there are quite a number of resources she's attached to the slides that we can also use in our preparation. And wish everyone all the very best. Thank you very much. Okay.
Thanks,
Thank you so
Mayo.
much. Sarah.
Thank you. Bye-bye.
Okay. Chief, I do. How your slide though?